lately. But Arosti's here today, and I would say y'all are like a manual muscle manipulation
Yeah,
type of
muscle therapy.
So they're going to kind of walk you through that and what that means and how they can help you versus maybe, go into the emergency room, I would say, or
Chiropractors,
things
that's
like
usually
that.
the people who come to see us too.
Yeah, so he's gonna talk to her for a little bit, and then we'll do a 30-minute or ish, however long y'all have questions for, and then I think some of y'all have assessments scheduled with him afterwards. All right.
Cool. All right, thank you. So my name is Dr. Cam Leung. I'm a chiropractor by training, but the work that I do is not what people think of when they think chiropractor. So Arosti is a soft tissue management system where we evaluate things that are muscle, ligaments, tendons, bones, and if there's something wrong, not working right, we kind of put together a program to fix that. So it's a lot like PT, physical therapy exercises, and deep tissue massage, but we're very focused on specific things. So I'm going to talk about a few of those things today. The topic originally was going to be headaches, how types that we can help with, and how tension affects that. And then if you guys have any other questions, we can talk about other injuries like back aches and things like that, because I know that's a huge one. So half the people that I see are back pain and hip pain, and then the other half of the people I see are neck, shoulder, and headaches. So, we run through a lot of those cases every week, every month. So when it comes to headaches, there's multiple different types of headaches. The ones that we can affect are the ones that are generated by posture or tension that builds up from fatigue when you work at a desk for too long, or you have your head in a down position, or things like that. So I'm first going to cover like the basic anatomy of why that happens, and then what we can do to kind of help with that. So traditionally, when we're dealing with posture, it's about how we carry our head and our shoulders when we're in an upright position, right? So the head is about 17 or 18 pounds worth of weight. And every time we're upright, the body has to carry that weight somehow. So the most efficient way to carry the weight of your head is to have it load on something rigid, like your spinal column. It's made of bone, it can carry weight very easily. But that can only happen if your head is positioned back here where the weight drops down through the spinal column, right? So most of us when we're working, we don't spend our time back here, right? We spend our time here with our head in front of our shoulders. So when you do that, you unload the structures that carry weight well, and you force the muscles in your shoulders and neck to hold on to the weight of your head. So if it's just a few minutes, that's not a big deal. It's designed to handle stress like that. But if you're doing that all day long, and then you go home and you wash dishes, or you lay on the couch and you pull your head up to watch TV, all of that adds more stress to the system. And then at some point, the system fails, and then you start to get problems with your shoulder muscles, you can't turn as far, your shoulders are always achy and tight, and it's because of fatigue from long hours of using it in a way that's not advantageous for those muscles to be used. So general tension headaches form when those muscles in your neck are pulling so hard that they start to pull on the nerves on the back of your skull right here. There's one nerve in particular called the greater occipital nerve. It wraps around to the front of your eyebrow, and when your neck muscles and shoulder muscles are yanking on it all day long, it irritates it, and then you start to feel this like headache that forms behind your eye or your brow. So we usually can test for that by putting pressure on the muscles back here, and if I hold onto a pressure point and you feel your headache kind of just start winding up, then we know that that's a tension type of headache that we can help resolve by clearing tension out of the muscles. But it's only partially resolvable in the clinic, because we can clear out the muscles and it'll last maybe a few days or maybe even a couple of weeks. But if you don't do things to correct the initial problem of having your head like this all day long, then it's going to come back, at some point in the future. So you have to learn, what's going to be acceptable for your neck to do for what, how long, and what to do about pressure that builds up so that you can clear it on a regular basis. Otherwise, you're constantly running into the clinic to get work done all the time if you don't have strategies or techniques to kind of get rid of that stress on a day-to-day basis. So that's what we teach at Arosti. We teach, where those spots are, what winds up, and I'll demonstrate it in the clinic like, this is where your problem is, because when you push on muscles that are fatigued and overused, they feel sore like they've been working out too long. So once you clear it out, it doesn't feel like that, but once you go back to work and start using it again, it starts to build up. So it's like a gradient, right? So you can't fix something if the fatigue doesn't happen until you do it, later on in the future. So you have to kind of manage it by keeping tabs on it and making sure that you clear it often enough where it's not yanking on the nerve and causing headaches. So that's just the type of headaches that we typically can affect with the work that we do. There's different types of headaches that we don't really have much impact on, like if you're allergic to something and you're eating those foods or something like that, and you get those type of headaches, we're not going to be able to do a whole lot about those. Or allergies and sinuses and things like that. We can give you recommendations, but it's not something that we deal with in the clinic. Stress headaches, well, stress affects tension in the muscles in your neck and shoulder, so it is something we tend to help with as well. And then there are kind of peripheral issues that are related to that same mechanism that people don't associate with being part of it. Like people come to us with vertigo, right? Like, oh, when I try to move my head around, the room spins, right? And I've been to this doctor and that doctor, and nobody can tell me what's going on. So a lot of times, because their neck is so wound up that it pulls into the nerves that go deep underneath in their inner ear, and that pressure and tension messes with the nerves so that when they move their head around, it sends different signals to the receptors that keep their ear in balance, and they feel the room spin, right? So if it's positional, where you're going up and down and it makes the room spin, chances are it's related to stuff that builds up, and that goes back to posture, how long you hold your head in a position. So that's correlated. So a lot of cases clear up when we start to work on those. Other thing is TMJ and face pain. So when your jaw starts to hurt and it starts to lock up, and you go to the dentist and we don't see anything wrong there, your teeth are fine. It's because those same muscles that I'm talking about from stress in posture pull underneath your jaw and starts to cause stress. So if a muscle is tight and your jaw needs to work against it, other muscles have to work harder, and then things start to freeze up from overworking, and now you have like tension in your jaw. So clearing up tension in the neck and shoulder helps with that as well, but people don't associate that with TMJ. I need to go to a muscle person to clear that up. Right? They usually go to the orthodontist or dentist, which you wear mouth guards and other things that they give you, but that's kind of more like a crutch and not a long-term solution, because you're not correcting the muscle in your neck and shoulder with those appliances, which means that if that's triggering your jaw to tighten, it's going to be an ongoing situation, right? That means you'll have to wear your appliances for a long time to relieve symptoms. So it's not the best way to deal with it if it's coming from the neck. So those are very common things. Obviously, shoulder motion, like, oh, I can't reach behind and unclasp my bra, or I can't, shampoo my hair because my arm doesn't raise high enough. It's because the same mechanism, when large muscles start to overwork, they have their own gravity, right? That's how I like to think about it. Everything shrinks towards the tension, right? So if something is pulling real hard, you have muscles that need to move your arm in opposite directions, and those muscles have to pull not only the weight of your arm, but against the pressure of a stronger muscle. So they fatigue, and now you're having tug of war between the front and the back, or top and the bottom, and then your shoulder starts to freeze up, and now you can't reach behind your back and scratch, or you can't come up here. So people have this, during certain times, in their lives, and they just figure, oh, that's just old age or whatever. But I often say your other shoulder's just as old, right? No problems on the other side. So something's going on here that's making it wind up, unnaturally. So we work through those issues. We give exercises. We give, therapies that you can do at home to kind of clear out tension, and stretches to do. And for the most part, most people who stick with the program clear up usually within about 3 weeks. I mean, I see a lot of people, hundreds of cases a year. The vast majority of them resolve within about 3 or 4 visits, which is crazy if you think about when you go to other providers. It takes, usually it's measured in weeks and months, sometimes years, not in days and weeks. So that's kind of Arosti's claim to fame as an organization. Like, we have the highest ratings of any medical organization on the planet, and our average over millions of cases of people coming in, you know, limping or not able to move their shoulder, the average resolution time is 3.2 visits for all of the cases, right? So, but one thing you should know, the work that we do is pretty intense. Like, when you go to Arosti and we start pushing on knots, you know, people feel it, right? So you don't expect to go in and think it's going to be a massage or something, because, you know, we have to breathe through some of the stuff that we work on because it's so wound up, right? But we try to work within people's tolerances, and, you know, I try not to make people cry too much on my tables, so we get through it. Right? Everybody gets through it. It's just a matter of how quickly and how much they can take. Right? So besides for the neck and shoulder stuff, you know, every once in a while we'll have athletes, they tweak their ankles, their hips, their knees. We work on that too. But, you know, in most cases, it's not sports injury or accidents. It's going to be repetitive stress type of things, like fatigue issues like that, right? So head and shoulders, big, you know, I see a lot of people with those issues, probably if you work at a computer. I can give you a few tips that you can implement without even coming into the office. Like, if you start doing these things, it'll immediately change your situation for the better, right? So let's first talk about what good posture actually looks like, so that we're reducing the amount of stress that builds up into the neck and shoulders. So ideally, when we're looking at the body from the side profile, we want the earlobe and the center of the shoulder to be in the same plane. Because when that happens, the weight of the head goes down through the spine and everything is carried where it should be carried. So you can put a phone next to you, film yourself working. If you spend most of your time here, then some work needs to be done to kind of bring you back into a side-to-side profile and your chin directly back over your shoulders. An easy way to do that, so you don't have to think about it, is to get your screen, whatever you're viewing, to raise it up so that it's face height, and to pull it over your hands so that it's close enough so that you don't lean forward into it. Because one of the biggest issues is the screen's too far away, it's too low, and when there's fine print, you kind of go like this, right? And when you do that, you automatically put yourself into stressful posture for the shoulders, and if you're doing that constantly throughout the day, then things build up. So that one change alone will probably reduce about 50% of the stress that would otherwise build up, and, you know, and then you don't have to clear out that stress afterwards. So that's like, you know, easy fix. The other big thing is going to be lower back. We haven't gotten into that yet, but probably the most useful thing to know about the low back health is that sitting to the back is like smoking to the lungs. You can't have a healthy low back if you're spending 8 hours a day sitting in a chair. So yes, I say that all the time. So if you're having to work at a workstation, the best long-term solution for back health is to have a permanently standing desk. You don't have to get a fancy one. You can use one of these type of desks, put a few stacks of binder paper or printer paper reams, get another flat board or tabletop, put it on top of that so that your tabletop is right below your fingertips if your elbows are bent at 90 degrees. This is the position that you should be working if you're standing. Keyboard right here, screen right there, okay, standing. So when you're standing, it's going to cause your feet and your knees and other things to fatigue and hurt. But the goal is to share the load between the back and the feet so that it's not going all into your back, right? So a good solution to that is to have a tall stool, like a wooden kitchen stool, that's just high enough to come up to like the edge of your butt. So when you get tired of working in the standing position, you can just park your butt on that chair and you're taking the stress off your feet, but you're not fully seated in a 90-degree position, which causes tension to build up in your back and hips. Now, today's talk is not going to go into the mechanism about, you know, what happens when you're sitting for long periods, but maybe in the future we can do that and talk about, you know, what goes on down there that causes back problems, right? But it does. Sitting causes back problems over the long term. So we want to spend as little time in the chair as we can, right? So that includes hobbies, you know, at home when you're thinking that you're relaxing and you're in the couch, like this, and you're still at 90 degrees, that still counts as sitting. And when you're driving from place to place and you notice that getting out of the car is difficult after sitting in the car for 20 minutes, same type of situation, because tension builds up and it's hard to get rid of after it builds up, unless you know how to do it, right? Most people, they'll go to massage therapists or have somebody push on the knots, and you can only do that so often, right? I mean, who goes to the massage therapist every week? Not very many people, right? So, yeah, you'd like to, but yeah, nobody has the time or the money to do that, and it's a luxury most of the time. But there are ways to keep that pressure from building and to release it on a regular basis so that you don't have to go. And still keep your back healthy. And that's what we teach at Arosti also. Once you come in and you've kind of gone through a series of treatments, we give you exercises and stretches. In fact, my rehab specialist, Marissa, she's an alum of the elementary school back here. She's the one who teaches the exercises and the rehab for the patients that see me. So once you learn that, that's applicable for life. Once you have those skills, you can use that forever, and maintaining the health of your back keeps a lot of bad things from happening, because arthritis, disc degeneration, sciatica, all of those things happen because of buildup of stress over time, grinding down your discs and grinding down your joints in your back, which eventually leads to surgery down the road, if it gets bad enough. But that's preventable. If you know how to take care of it at a young age, you can prevent all of that wear and tear from happening by keeping things working the way that they should. It's kind of like if you only brush your teeth when it hurts, how healthy would your teeth be, right? So people take care of their backs like that. They only deal with it when something bad is happening. They don't really focus on it when, to keep it healthy, like flossing or brushing for the teeth, they're like, oh, it's supposed to always work and forever, but that's not how our systems work. You have to do some type of work a little bit at a time to kind of keep things in shape, otherwise things start to go bad. And from what I see, at 40 years old is the same as when a car hits 80,000 miles. If you stop doing maintenance on your car at 80,000 miles, things are going to start to fall off. That's the same as the body once you hit 40. You have to do some type of maintenance to keep things going. If you don't, you're going to start to have problems, right? So the maintenance is pretty simple if you know how to do it. It's just a matter of putting that time in every week. But if you don't do it, things accumulate, and that's when people get into trouble. So we talk all about that in depth in the clinic about, if you come in with a specific issue, we'll talk about how to manage it, the best practices, and we're updating things all the time, and Arosti is like the cutting edge, best in the world at what we do. So there are only Arosti clinics in 4 different states, and I've worked in other states, from California, and I've been a traditional chiropractor for 20 years and did the whole adjusting and other types of muscle therapy. So when they told me about Arosti before I moved out here, they said, oh, we resolve cases in 3.5 visits. I'm like, you're lying. Nobody does that, because I've had 20 years of practice and I didn't see that anywhere else in the nation. So when I came out here and started working with Arosti, I was like, wow, it's actually true. So yeah, I can speak from experience that there's no better organization as far as getting people back to doing what they're doing, and not constantly having to run back into the office to get stuff to work. Because one of the most annoying things is when you go to a chiro, is they always have you come back for maintenance or doing things like pretty much forever, right? So with Arosti, it's not like that. Once you're done, you're done. Unless you injure yourself again in the future, or you stop doing your rehab and things build up, then you come back into the office and we'll get you back in shape. But once you're done, you're kind of on your own, managing it on your own, because we give you all the tools to do that. And that's why people kind of like us so much, because less time, less travel back and forth, less pain on the table when I'm working on you. So that's all good stuff. So I'm getting close to the end of the time as far as the presentation, but if y'all have any questions on anything that I talked about, please raise your hand, let me know, and we'll cover things one by one. Okay?
Did you say it's only in 4 states?
Yes, it's only in 4 states.
Is it because it's newer, or why is that?
It gets hard to, you can't have, well, I don't know like the specific reasons, because that's like a pay level above mine, But my guess is that you need a management presence on the ground to, start up a region where somebody knows what they're doing and can direct the other docs to do that. And it's hard to get people to move into some states just to work because, they want to live where they want to live. So, yeah. And
Where are y'all located?
we're here in Texas. That's where we started. We're in Virginia, Ohio, and Washington State. I don't know why those specific states, but probably has something to do with somebody wanted to move into those states and still work with Arosti. So they kind of branched out and opened up offices
So for
there.
us to come and visit you, where would be the closest location?
The closest location is my office, which is in Liberty Hill, right on 29. It's about half an hour east of here. It's inside an ARC clinic at present, but most Arosti offices are in their own building, like a standalone building with multiple docs. But Liberty Hill was a new market when I moved to Texas, so they were testing it, so we kind of rented space out of a clinic just to see what the market was out here.
So you were talking about the jaw, like the neck muscles. I have two girls with their jaw now pops through the cheek.
Mm-hmm.
One of them fits in your category of totally leaning over, and the other one, we're just kind of wound tight, muscular.
Mhm.
But both of them, their two is like pop.
Mm-hmm.
Is it most likely something they need to have worked on muscularly?
Well, I'm
Or
not
maybe
sure.
start?
I'm not sure without actually seeing them and doing testing on them, but that would be probably the lowest invasive thing to do to start with. And if that doesn't work, you still have options to do other things.
Mhm.
Right.
I know one chiropractor told my oldest daughter that you would pop something for her back in,
Mhm.
but
So-
since the pulling.
Right, so sometimes just adjusting the joint, if it's stuck, then that usually, loosens it up enough where it fixes it for a while. But if it's a repetitive tension type of situation, you're gonna need more than just an adjustment. You're gonna need the tissues to be unwound on a regular basis.
Do y'all do any conversation?
College Station, might have to check, I'm not sure.
I can look that up.
Yeah,
You do?
Oh, okay. yes.
So do y'all also do adjustments as part of Arosti, or?
They highly discourage Arosti practitioners from adjusting in the clinic because it's hard to replicate the same type of adjusting when there's so many different providers, but the tissue work is easier to reproduce. So for that reason, they want to keep things consistent, so yeah. I don't adjust in the clinic.
Yeah, so like if you could fix whatever the issue is with Arosti,
Mhm.
you can do that, but then if it was something that couldn't be fixed, like a joint issue or
Right.
something.
We network with some of the best doctors in the region, orthopedists, neurologists, just anything that you can think of that's not what we do, we have somebody for. And we send our patients for referrals all the time. Like if you broke something, I'm not fixing a broken, bone in the clinic, so I'm gonna refer you to somebody else, who's gonna fix that for you or give you some options, yeah.
You have licensed therapists, physical therapists, so you work with that too? Can you-
Licensed physical therapist.
Yes.
We might have one or two PTs working with the Arosti, but the vast majority of the providers are chiropractors by training.
Okay.
But we get specialized training through Arosti to do, what we do in the clinic. Yeah, the therapies, yes. But a lot of the exercises that we give mirror PT exercises almost exactly. So,
Okay.
yeah.
Do you band exercises? What do you do when you do?
Depends on what the issue is. If it's,
Back.
well, mostly if it's from sitting, it's going to be stretching out the muscles that are wound up tight, clearing out knots, and then strengthening the muscles that need to be strengthened. So band exercises will come in at some point there, but that's not the first thing that we go to.
Do y'all deal with any kind of plantar fasciitis?
Oh, yes. Let me tell you, plantar fasciitis is the most painful thing that we work on. When people, come in and they've experienced other Arosti therapies, it's a 10 out of 10. I've had,
But it does help?
yes, it does help. It takes the longest and it hurts the most, but we can resolve plantar fasciitis. So my experience, plantar fasciitis, 90% of the issue is above the ankle. Most people, when you go for plantar fasciitis, regardless of where you go, is going to deal with it from the ankle and below. right? But in my experience, 90% of it is above the ankle. If you don't take care of what's above the ankle, you're not going to fix it.
So where's 90% of the sciatica problem?
It's going to be 3 places.
Paraforming?
That's one of those places. So your nerve that eventually becomes a sciatic nerve starts in the spine, right? So if you have a disc bulge pushing on the spine in a certain spot, it can mimic sciatica because it affects the same nerve. If it's there, we're not going to be able to help a lot because it's inside, encased in bone, and we can't touch it. Once it exits the spine, it crosses under large muscles inside your pelvis, and if it's being crimped there, you can have sciatic symptoms, and we can help with that. And then as it exits through the glute, it comes through the piriformis, and if that's squeezing it, it can cause sciatica, and we can help with that. So I would say 2/3 of those regions that sciatica happens in, we can help. 1/3, we can't. So it just depends on where the sciatica is originating
You
from.
would be able to tell just by like
For the most part, yes. Nobody can say for certain unless they have imaging, whether a disc is pushing on it. But imaging is usually fairly expensive, and because it only takes us 3 to 4 visits to resolve things, most people will say, well, let's just try 3 or 4 visits. If it fixes it, I don't have to get MRIs. So that's what we do. Yeah. Other questions? No?
we sign up, where do you live?
Yes, yes. So we have like a injury assessment after the talk today. So in the back, you can sign up and spend 10 minutes or so telling me specifics about what's going on, and I can give you my opinion whether we can help you or you should go to somebody else. And then if we can help you, Marissa can schedule an appointment for the clinic in Liberty Hill, and then we can get you in. And I've been told that your copay is $25, so which is huge, yes, because our rates start at $250 up without insurance. So it's a huge benefit to be able to come in for $25. So, any other questions?
I have a question, I have a comment. My daughter used to undergo Arosti treatment. She
Mhm.
had SLJ
Mhm.
in her knees
Mhm.
from gymnastics, from the compression.
Right.
And she was like 10,
Mhm.
and she went, I want to say twice a week for like 4 weeks.
Okay.
It was pretty bad.
It's pretty bad. And she was still doing gymnastics at the
Well,
time?
yeah, y'all fixed it, or they fixed it,
Mhm.
and then, they said, if you go back to gymnastics, it's just gonna, go back.
Yeah, well, we can't make people like, superhuman.
Exactly.
Yeah, we can bring them back to normal, but if you're pounding on it by doing like gymnastics or other things similar to that, you're going to wear it down and, cause injuries again, so.
Well, we ended up pulling her out of gymnastics for that reason.
I had to pull my daughter out of gymnastics for similar reasons. Too injurious of a sport, but.
But it did help.
Yeah.
And it hasn't come back since
Right.
she quit gymnastics.
What's the youngest age that y'all see?
People who can follow instructions to do exercises at home, because a lot of it depends on them doing the right things at home to help themselves clear out the tension, build up whatever it is that we need them to do. So if they're not a person, young or old, because we have that too, we have retired people who are like, no, I don't want to do my exercise. I'm like, well, we can't help you. So, yeah.
I did tell, my oldest daughter came to Rossi, and she had high ankle
Mhm.
sprain, and she came in limping, and they had to run up and down the hallway before she left. It hurt.
Yeah.
Yeah.
Yeah. Yeah. But it's the quickest way to get better. So that's the trade-off. Yeah, it's pretty intense, but it also works very fast. All right, so if no more questions, I think there's some food up front if we're still hungry. And then we have assessment appointments available. So if you want to get something checked, speak with Marissa in the back, and she'll set you up for that.
Thank you. Your cards.
Yes, we have all our information back there. Thanks for having me. It's great. Great being here.
Just Dr. Rosaki,
Mhm.
does he work with y'all?
Yes.